there is different type of risks we can see in different diabetic. Like for example, in type 1 diabetics we have a different risk, and type 2 also. In type 1 diabetics, the body makes no insulin or not enough of the hormone. This condition occurs, it's around 5% of those with diabetics. So the risk factors are basically, main risk factor is family history. Having a parents or sibling with type 1 diabetics increase the risk of a person having the same type. If both parents have the type 1 diabetics, the risk is even higher. And second one risk is age. Type 1 diabetics usually develops in younger adult and the children. It is one of the most common chronic conditions that developed in the childhood. Children are typically younger than 14 years old when they receive a diagnosis. Type 1 diabetics might occur at any age, although developing type 1 diabetics later in the life is rare. Next one is genetics. Having a specific genes may increase the risk of type 1 diabetics. A person's doctor can check for this genes. Next is type 2 diabetics. Type 2 diabetics is most common forms of diabetics. In type 2, the body can still make some insulin, but it's not able to use the hormone as effectively as it should. Insulin usually allow cells to absorb glucose. However, the cell can become less sensitive to insulin, leaving more sugar in the blood. If blood sugar is permanently high, a person may have developed type 2 diabetics. An increase in blood sugar can lead to damage in the body. Type 2 diabetics often moves through a stage called pre-diabetics, during which a person can reverse the progress of this condition with a healthful lifestyle choices. So type 2 diabetics have different types of risk, like frequent infection, blurred vision. Okay, so these are the basically risk of type 2 diabetics, sometimes depressions. So these are the basically risk of type 1 and type 2 diabetics.